vs. Medicare Advantage. Hello, friend. If you're turning 65 soon, or you're already enrolled in Medicare, you've probably come across two important options: Medigap and Medicare Advantage. Both are designed to help cover the gaps that original Medicare leaves behind. But here's what many people don't realize. These two plans are fundamentally different in how they work, how much flexibility they offer, and what they'll cost you over time. And choosing the wrong one, that can lead to unexpected medical bills, limited doctor choices, and frustration you don't need in retirement. In this video, we're going to walk through the key differences between Medigap and Medicare Advantage in 2025. I'll explain clearly and simply how each plan works, what it covers, and how to decide which one best fits your health needs, lifestyle, and long-term goals. Because when it comes to your healthcare in retirement, clarity matters, and peace of mind is priceless. Let me know if you'd like the next segment. Certainly. Here is the main content section of our video, rewritten in the clear, compassionate voice of a respected U.S. insurance expert who specializes in Medicare and senior healthcare, designed to inform and while guiding you toward the right decision. Now let's take a closer look at the two main Medicare options you've likely heard about: Medigap and Medicare Advantage. While both are designed to help fill the gaps left by original Medicare, Parts A and B, they do so in very different ways, and understanding these differences is key to choosing the right plan for your needs. 1. What is Medigap, also called Medicare Supplement insurance? Medigap is designed to work alongside your original Medicare coverage. That means you'll still have Medicare Part A and Part B, and Medigap steps in to cover your out-of-pocket costs, things like deductibles, coinsurance, and co-payments. One of the biggest advantages of Medigap is freedom. You can visit any doctor or hospital in the U.S. that accepts Medicare. No referrals needed, and no provider networks to worry about. This makes it a smart choice for people who travel often or live in more than one state throughout the year. Medigap plans are standardized across most states, meaning PlanG from one company offers the same benefits as PlanG from another. The only difference? The monthly premium, so it's worth comparing. Just keep in mind, Medigap does not include prescription drug coverage, so you'll need to enroll in a separate Part D plan to make sure your medications are covered. Example: let's say you're a senior who likes to travel between Florida and New York to visit family. With Medigap, you don't have to worry about finding an in-network doctor. You're covered wherever you go as long as the provider accepts Medicare. 2. What is Medicare Advantage, Part C? Medicare Advantage, also known as Part C, is a bit different. Instead of working alongside Medicare, it replaces your original Medicare with a private health plan approved by Medicare. These plans often bundle together hospital, Part A, medical, Part B, and drug coverage, Part D. Plus, they frequently offer extra benefits like vision, dental, hearing aids, and wellness programs like Silver Sneakers. Sounds appealing, right? And for many people it is, especially because Medicare Advantage plans usually have low or even $0 monthly premiums. But there's a trade-off. Most plans use networks like HMOs or PPOS. That means you may have to stick with a local list of doctors, get referrals to see specialists, and possibly pay higher out-of-pocket costs when you receive care. Let's say you're a senior on a tight retirement budget. You don't travel much, and your doctors are all in the same health system. A Medicare Advantage plan could give you low premiums and valuable extra benefits, all in one package. In short, Medigap gives you more flexibility and predictable costs, but typically comes with a higher monthly premium. Medicare Advantage gives you lower premiums and added benefits, but often requires you to stay in-network and manage more cost-sharing. And that's why the choice between the two really depends on your personal health situation, your lifestyle, and your financial comfort zone. Let me know if you'd like me to continue with the next section, Cost Comparison in 2025, Medigap versus Medicare Advantage side by side. Let's talk about what everyone's thinking, cost. When comparing Medigap and Medicare Advantage, it's not just about what you pay monthly. It's about the total value you get, the flexibility you need, and how much financial risk you're comfortable with. Cost comparison in 2025. Here's how the two stack up. based on the latest projections from Medicare Gov and the Kaiser Family Foundation. 1. Monthly premium. Medigap, PlanG. $100 $200 plus, varies by state. And Medicare Advantage. $0 plus, some as low as $0. 2. Doctor Hospital Access. Medigap, PlanG. Any provider accepting Medicare and Medicare Advantage. In-network, HMO PPO. Only. 3. Out-of-pocket limit. Medigap, PlanG. No cap, but very low costs. And Medicare Advantage, capped at $8,150, 2025 limit. 4. Drug coverage. Medigap, PlanG. Requires separate Part D and Medicare Advantage, usually included. 5. Extra benefits. Medigap, PlanG. Not included. And Medicare Advantage often includes dental, vision, hearing, fitness programs like Silver Sneakers. So, while Medicare Advantage plans may seem cheaper up front, it's important to weigh that against higher out-of-pocket costs if you need more frequent care, or if you go out of network. Can you switch plans later? This is where things can get tricky, and why your first choice matters more than you think. If you start with Medicare Advantage and want to switch to Medigap later, you may have to answer health questions during underwriting. Depending on your health, you could be denied coverage or charged more. On the other hand, switching from Medigap to Medicare Advantage is easier. You can do it during Annual Open Enrollment, OCT 15, Dec 7. Medicare Advantage, Open Enrollment, Jan 1, Mar 31. Important tip. If you enroll in Medigap within your first 6 months of Medicare eligibility, you have guaranteed issue rights, which means no medical questions asked. That's a powerful window of opportunity you don't want to miss. Final tips. So, which plan is right for you? Here's my honest advice after decades in this field. Choose Medigap if you want maximum doctor choice, you travel frequently, or you simply value predictable, low out-of-pocket costs. Choose Medicare Advantage if you're comfortable with provider networks, want extra benefits bundled in, and prefer a lower monthly premium. Remember, there's no one-size-fits-all answer. The best plan is the one that fits your health needs, your budget, and your lifestyle. Final tips for viewers. Start planning early, ideally 3 to 6 months before turning 65. Review your plan every year during open enrollment, OCT 15, Dec 7. And most importantly, talk to a licensed Medicare advisor before making changes. They can help you avoid costly mistakes and find the plan that truly works for you. If this video helped you better understand your Medicare choices, please give it a thumbs up, share it with someone you care about, and subscribe to the channel for more trusted guidance. Have questions? Drop them in the comments below. I personally read and respond to help you make smart, confident decisions because you deserve health care that supports your future, not complicates it.